Come in. Evening. I am April from one of the LSUA student nurses that works here, and I know your grandmother is down in CT doing her scan. Um, I just wanted to discuss with you a tool that we use to gauge whether our patients are at a risk for falling and injuring themselves while they're staying with us. So I'm going to give you this copy for you to look at with me. And we will also go over this with your grandmother when she comes back. And each shift is going to come in and be talking with you and your grandmother about her risk for falling. That's part of the way that we, as nurses, make sure that we're helping your grandmother not have a risk for falling while she's here with us. So, with your grandmother, obviously, from her history, I'm seeing that she had a history of falls. Did she recently fall at home?
Yes.
Is that what led to her coming to stay with us at the hospital now?
Yes.
Okay, so she does have a history of falls. When was the last time that she fell at home?
2 weeks ago.
2 weeks ago. When she fell, were you sitting with her at home or was she home alone? Alone. Does she normally, prior to this fall, was she using a walker or a cane to get around her house or walking independent
A rolling ball.
or rolling? Now that she's had her injury, does she still use the walker or is she not walking
With someone with her.
with someone with her? What about going to the restroom? Does your grandmother know when she needs to use the restroom and realizes that?
Sometimes.
Sometimes. Okay. So every 2 hours, we're gonna come in and assist her to the restroom. And if we can get your help with helping us with that, if she were to voice to you that she needs to go to the restroom, if you could use that call light for us to come down. But every 2 hours, we're gonna come in and help her go to the bathroom. We'll help her walk to the restroom during the day, and at night we'll place a bedside commode so it's closer to help her with. And your grandmother, I see that on her history, she has a history of dementia. And I know when I spoke to her prior to you coming to the hospital, she had some difficulties answering my questions. Is that a new onset of dementia or has this been going on for?
Recently worsening.
So I'm using this tool, and based on this tool, your grandmother is a high fall risk for falling. So what I'm going to do is place this TIPS tool on this board for a visual to help her. And again, when she comes back, we'll reiterate our teaching with her. But since you, Dana, is that
Right.
you're her primary caregiver and going to be staying here with her, I wanted you to have a copy and you and I to go over that while she was down getting her scan. So can you kind of go back over what we talked about for ways we're going to help your grandmother not to have a fall while she's staying here with us?
So she's gonna be using a walker with somebody.
Correct. So she's always going to use her walker when she gets up.
Okay, and so someone will come in every 2 hours.
Every 2 hours and looking at your pictures, which method she's going to go to the bathroom with how many persons to help her.
Okay.
Okay.
So first.
So one person.
Okay, and at night, the bedside commode, she will still be having somebody with her.
Yes, she will
Right,
still
so
have
you do.
assistance to use the bedside commode.
As far as the call light, well, I'll keep trying to remind her how to use it, and hopefully she will remember to use it.
Right. And hopefully this posted on her whiteboard will give her a visual to help her remember about getting a loan to at least to use your assistance or for you to call for our assistance to come down to the room.
So is this something that will be done, just once, or will this be done more?
So each shift will come in and talk to you about her needs, and especially as she's here with us as her therapy changes, the levels of what therapy's doing with her therapy, we will also discuss with you what her needs are to decrease her fall risk. Do you want to keep a copy of that
Yes.
to have with you?
And I will show the others that will be with her.
Okay, your other family members, and we can provide them a copy at any time when they come in for visits too. Well, thank you for your time, and I hope your grandmother does well here with us, and she should be back from her scan momentarily. So I'm gonna go now, but her call light is right there, and you can use that if you were to need anything prior to her coming back if you had any questions. Thank you, ma'am.